Welcome to our educational video on the surgical site infection bundle. Surgical site infections are a significant concern in healthcare, affecting up to 3% of patients undergoing surgery. Today, we'll explore how the SSI bundle can dramatically reduce these risks. The SSI bundle is a set of evidence-based practices that, when implemented together, significantly reduce the risk of surgical site infections. The key components are 1. Appropriate antibiotic prophylaxis, 2. Proper hair removal, 3. Maintenance of normothermia, 4. Blood glucose control, and 5. Proper skin preparation. Let's dive into each of these components.
Appropriate antibiotic prophylaxis is crucial. We need to administer the right antibiotic at the right time. For example, for a patient undergoing a hip replacement, we might administer 2 grams of cefazolin intravenously within 60 minutes before the incision. It's important to redose for longer procedures or in cases of significant blood loss.
When hair removal is necessary, we use electric clippers, not razors. Razors can cause microabrasions that become breeding grounds for bacteria. For example, for a patient undergoing abdominal surgery, we would use clippers to remove hair from the surgical site just before the procedure, not the night before.
Maintaining the patient's body temperature between 36 degrees Celsius and 38 degrees Celsius, or 96.8 degrees Fahrenheit to 100.4 degrees Fahrenheit, is vital. Hypothermia can increase the risk of surgical site infections. For example, we use forced air warming blankets during long procedures. For a patient undergoing a 4-hour spinal fusion, we would monitor their temperature throughout and adjust warming measures as needed.
Maintaining blood glucose levels below 180 milligrams per deciliter in all patients, diabetic or not, is crucial. For example, for a diabetic patient undergoing coronary artery bypass surgery, we would check blood glucose levels before, during, and after the procedure, administering insulin as needed to keep levels below 180 milligrams per deciliter.
Proper skin preparation involves using an appropriate antiseptic solution in a standardized manner. For most surgeries, we use a chlorhexidine alcohol solution, applying it in concentric circles moving outward from the incision site. For a patient allergic to chlorhexidine, we might use povidone iodine instead.
Implementing the SSI bundle requires a team approach. We've created standardized checklists, conducted staff training, and performed regular audits to ensure compliance. In our hospital, we reduced SSI rates by 50% within 6 months of implementing the bundle. Our orthopedic surgery department saw SSI rates drop from 2% to 0.8%.
We face challenges in consistently maintaining normothermia, especially in our older operating rooms. We solved this by investing in additional warming equipment and adjusting room temperatures.
The surgical site infection bundle is a powerful tool in preventing infections. Remember, it's most effective when all elements are implemented together consistently. By following these evidence-based practices, we can significantly reduce the risk of surgical site infections, improving patient outcomes and reducing healthcare costs.